Hello everyone, welcome to my channel. Today I am going to explain about hospital formulary. So what is a hospital formulary? It is a list of medicines approved for use in the healthcare system by authorized prescribers. So it is a restricted list of medicines or drugs that are used in the hospital to which the prescribers have to adhere to. So the prescribers cannot prescribe medicines or drugs beyond the hospital formulary. The formulary manual, the document that describes medicines that are available for use in a hospital or clinic. So formulary manual gives the complete details of the drugs or medicines that are available in the hospital, like indications, so which diseases the drug can be used, then dosage, the doses, children dose, adult dose, then doses in renal failure, heart failure, or liver failure, so doses in certain conditions, then length of treatment, the duration of treatment, for how many days the treatment should be taken, then drug interactions, drug food interactions, drug alcohol interactions, precautions to be taken while taking the drugs, and contraindications, in which conditions the drugs should not be taken. So all this information will be included in the formulary manual. Then formulary system, a system of periodically evaluating and selecting medicines for the formulary, maintaining the formulary and providing information in a suitable manual or list. So to select the drugs in the formulary and to maintain the formulary, there should be a system, that is formulary system. So this system will periodically, every month or every year, they will be evaluating the drugs that are present in the formulary. They will be evaluating their safety, efficacy, cost effectiveness. Are they being used by the patients? Are they being sold in the hospital pharmacy? So everything will be evaluated periodically and selecting medicines for the formulary. So if at all some medicines are not being used, then they will be deleting the medicines, or if some medicines are proven to be more safe and efficacious and more cost effective, they will be selecting those medicines for the formulary. So it's a periodical evaluation system and selecting medicines for the formulary and maintaining the formulary. So they will keep maintaining the list of the drugs to be used in the hospital and providing information in a suitable manual or list. So all the information related to the drugs will be provided in the form of a manual. So what is the definition of a hospital formulary? The hospital formulary is a list of pharmaceutical agents with its important information which reflects the current clinical views of the medical staff. The hospital formulary system is a method whereby the medical staff of a hospital, with the help of pharmacy and therapeutic committee, selects and evaluates medical agents and their dosage form, which are considered to be most useful in the patient care. So the hospital pharmacist, along with the medical staff and along with the pharmacy and therapeutic committee, they will be selecting a list of medicines or drugs which are more beneficial, more useful to the patients, which are safe, effective and cost effective. So these will be selected and evaluated, and they will be included in the hospital formulary. The hospital formulary system provides the information for procuring, prescribing, dispensing and administering of drugs under non-proprietary or proprietary, that is branded names, in instances where drugs have both the names. So we can get information from the hospital formulary for procuring, that is purchasing or collection of drug stock from the manufacturers or wholesalers. The hospital pharmacist will be purchasing or procuring the drugs. So how they will be procuring the drugs? based on the hospital formulary. And while prescribing, so the physician has to stick to the hospital formulary and they have to prescribe accordingly. Whatever drugs are given in the hospital formulary should be prescribed. And also while dispensing and administering of drugs by the nurses, the hospital formulary should be followed. So whatever names are given, proprietary, either generic name or brand name, whatever is given in the hospital formulary, that should be followed. If both names are there, both names can be included in the prescription. Then origin of hospital formulary. The first scientific hospital formulary in India was published in 1968 by the Pharmacy Department of CMC Vellore, Christian Medical College, Vellore. The first hospital formulary for a government teaching hospital in India was published in 1997 at Government Medical College Hospital, Trivandrum. So both Vellore and Trivandrum are located in Tamil Nadu, state of Tamil Nadu. So what are the advantages of having hospital formulary? It helps in therapeutic decisions. So while prescribing, we have to make therapeutic decisions. So which drug is more cost effective, more safe, more efficacious, and which drugs are more useful in the patient care, which are more which drugs are being taken more by the patients. Like some of the drugs the patients won't be adhering to, so there won't be medication adherence to some particular drugs. So which drugs are being taken more by the patient, whether there is compliance to the drug or no, such therapeutic decisions can be taken using hospital formulary. Then economic decisions, while purchasing the drugs in the hospital pharmacy, so which drugs have to be taken, which drugs have to be purchased from the manufacturer to make the hospital more economical, more profitable. So it should not cause any kind of economic burden to the patient, as well as it should not cause any loss to the hospital and the hospital pharmacy. So while taking economic decisions, hospital formulary is useful. And also to provide educational purposes, like some of the medical staff, if they are not having a certain knowledge on certain drugs, they can refer to the hospital formulary. So it helps in educating the medical staff, non-medical staff, and also all the hospital staff, and also patients. And also for rational drug use. So rational drug use is the use of right drug at the right time for the right duration at a right dose in the right patient. So for rational drug use, hospital formulary is helpful. What are the disadvantages? So it deprives the physician of his right and privilege to prescribe and obtain the brand of his choice. So since the physicians have to adhere to the restricted list of medicines given in the hospital formulary, they cannot prescribe whatever drug they want. They have to completely stick to the hospital formulary drugs. So the physician loses his or her right and privilege to prescribe and obtain the brands of his or her own choice, and permits the pharmacist to act as the sole judge of which brands of drugs are to be purchased and dispensed. So here hospital pharmacist plays a very major role in the judgment of which brands to be purchased from the manufacturer and wholesaler and which brands to be dispensed while preparing the hospital formulary. Then guidelines in preparing hospital formulary. The governing body of the hospital shall appoint a pharmacy and therapeutic committee composed of physician and pharmacist, which will prepare the hospital formulary system. So there is a board of directors in the hospital, that is the governing body. They will appoint pharmacy and therapeutic committee consisting of physician and pharmacist. They will be preparing the hospital formulary system. The medical staff in the governing body shall sponsor and outline the purpose, organization, function and scope of hospital formulary system. So the medical staff that are present in the board of directors or governing body, they will be sponsoring and they will be outlining the purpose and organization, functions and scope of the hospital formulary. It should adopt the principle as per the need of particular hospital. So based on the need of the hospital, based on the drugs, diseases that are being treated in the hospital, based on the group of people that are being treated in the hospital, they should adopt the principles and they should adopt the drugs or medicines accordingly. The pharmacy and therapeutic committee shall develop policy and procedure governing the hospital formulary, and the medical staff shall adopt these policies and procedures subject to administrative approval. So the pharmacy and therapeutic committee, they will be developing policies and procedures and strategies for hospital formulary, and the medical staff, they should follow all the policies, procedures and strategies which are developed by the PTC, pharmacy and therapeutic committee, and which are approved by the administration. Administration is the governing body or the board of directors. So board of directors will approve the policies and procedures that are developed by the pharmacy and therapeutic committee, and the medical staff should follow all the policies and procedures that are developed by the pharmacy and therapeutic committee. The policy and procedures shall afford guidance in the appraisal, selection, procurement, storage, distribution, use, safety procedures and other matters relating to the drug in the hospital, and shall be published in the hospital's formulary or other media available to the members of the medical staff. So while framing these policies and procedures and strategies, the PTC will take guidance from the medical staff as well as hospital pharmacist while appraisal, that is reviewing of the drugs or medicines, and also selection of drugs or medicines to be included or not included in the hospital formulary, and procurement, that is collection or purchasing of drugs from the manufacturer or wholesaler, or also while storage and distribution of drugs inside the hospital, while use and safety procedures and other matters relating to the drugs in the hospital. And they will publish this information in the hospital formulary or other media like newsletters. Now they will be including this information in the hospital formulary or any other media like newsletters, and they will make it available to the members of the medical staff, so that they are aware of the drugs that should be prescribed, administered, dispensed and also procured. To ensure the maintenance of the responsibility and procreative of the physician in the exercise of his professional judgment. So while physician is prescribing, he has to be very procreative and he has to maintain his responsibility. So he has to adhere or stick to the restricted list of medicines or drugs given in the hospital formulary. The medical staff shall adopt the policy formula and procedure for including drugs in the formulary by their non-proprietary names, even though proprietary names continue to being used in the hospital physicians. So usually medical staff should adopt the policy, that is policy and procedures for prescribing the drugs by non-proprietary names, that is prescribing by generic names, even though proprietary names like brand names are continuously used in the hospital by physicians, but the policy and procedures of hospital formulary, they encourage the medical staff to write the prescriptions in generic names. He may be encouraged to prescribe drug under their non-proprietary names, although nomenclature used is entirely a matter of individual practitioners' discretion. So we have to the hospital formulary encourages the physicians to prescribe in non-proprietary names, that is generic names of the drug, but it is a matter of practitioners discretion. It is a matter of practitioners own choice to maintain the drugs in either non-proprietary names or proprietary names. In the absence of written policies approved by the medical staff related to the operation, the hospital shall make it certain that the nursing personnel are informed in writing, though its system of news of communication, that there exists the formulary system in the hospital and the procedure governing its operations. So, in most of the hospitals there will be written policies made by the PTC, which is approved by the medical staff relating to the operation of hospital formulary, and it will be made clear to the nursing personnel or nursing staff on how to administer the drugs based on the hospital formulary. But if at all there are no written policies in a particular hospital, we have to inform the nursing personnel in writing by any news of communication, by newsletters. By newsletters they can communicate to the hospital nurses about the hospital formulary system and the procedures of the hospital formulary system. In the formulation of policies and procedures, the term substitute or substitution should be avoided, since these terms have been used to imply the unauthorized dispensing of entire different drug, neither of which takes place under a properly operated hospital formulary system. So while prescribing, dispensing, administering, everywhere they have to follow the hospital formulary system. So we have to avoid the term substitute or substitution while preparing the hospital formulary. The policies and procedures of the hospital formulary should not contain the terms like substitute or substitution. This is because we have to avoid dispensing or prescribing or administering of unauthorized drugs. It shall be made known to the medical staff about the changes in the working of the hospital formulary system or in the content of the hospital system. So whenever any changes are made in the hospital formulary, a drug gets added, a new drug gets added, or a drug gets deleted. So whenever there are changes in the content of the hospital formulary, the medical staff should be made aware of it, as well as the hospital pharmacy staff, the nursing staff. All the hospital staff should be made aware of the changes in the hospital formulary. Provision shall be made for the appraisal of the member of the medical staff for the use of the drug not included in the formulary or the investigational drugs. So in some of the hospitals, research work will be taking place. So clinical trials, human clinical trials will be taking place, where they will be using investigational new drugs which are not available in the market. So they are in the phase 1, 2, 3 of the clinical trials. So those kind of drugs, the provision shall be made for the appraisal of the member of the medical staff for the use of drugs which are not included in the formulary or drugs that are being used for investigational purpose. So medical staff will be, or physicians will be using drugs that are not yet available in the market. Drugs are which are in the clinical trials, phase 1 to 3. So those drugs should also be those drugs which are not included in the formulary should a provision should be made for the appraisal of those medical staff. The pharmacist, with the advice and guidance of the pharmacy and therapeutic committee, shall ascertain the quantity and source of supply of all drugs, chemical, biological and pharmaceutical preparations used for diagnosis and treatment of patients. So while purchasing the drugs, the pharmacist he should take the advice and guidance of pharmacy and therapeutic committee, and he should be able to ascertain the quantity and source of supply of all the drugs, chemicals, biologicals, pharmaceutical preparations which are used for diagnosis and treatment. Then labeling of drug and medicine container with non-proprietary name of the content always should be proper. So while labeling the drug, we have to label the container with non-proprietary name, that is generic name of the content. The use of proprietary name other than that describing the actual content is not correct and proper if it is used in a manner that can be taken as description of the content. So while using proprietary name, we have to check whether the proprietary name and the contents of the container are the same or no, because proprietary name has a brand name. So whether the content of the container is correct and proper based on the proprietary name, we have to check. Preparation of formulary. So the formulary should be visually pleasing, easily readable and professional in appearance. A typical formulary must have the following composition. First, title page, then names and titles of the members of the pharmacy and therapeutic committee, then table of contents, then information on hospital policies and procedures concerning drugs, then products accepted for use at hospital, then comes the appendix. So what are the contents of a hospital formulary? So first is introduction. Under introduction, there are list of abbreviations and the list of drugs used in the formulary. Then under basic information on each drug, there is efficacy for the treatment of specific conditions, safety profile of the drugs, interaction profile, drug interaction profile, adverse effects, pharmacokinetic profile, availability of the item, whether the item is available in the hospital or no, available dosage forms, cost of the drug, acceptability to the patients, whether the patients are willing to take the drug or no, whether there is medication adherence or no. Then supplementary information on each drug like storage guidelines, patient counseling information, labeling information, brand names and prices. Then under prescribing and dispensing guidelines, there are principles of prescription writing, reporting of adverse drug reactions, prevention of adverse drug reactions. Then under general drug use and advice, there is use of IV drugs, how to use the IV drugs, IV infusion, IV push, IV bolus, how to administer these drugs. Then special situations like pregnancy, breastfeeding, liver or kidney diseases, then poisoning information and antidotes, treatment of snake bites and insect bites. These information are available under general drug use and advice. Then miscellaneous section consists of children's dose, renal adjustments, metric units, that is dosage calculations in children, in liver failure, in pregnancy, in breastfeeding, in kidney diseases. So all the dosage calculations, everything will be mentioned in the metric units. Then diagnostic AIDS. So what is your responsibility as a hospital pharmacist? So hospital pharmacist plays a vital and key role in drug selection. So drug selection, what drugs should be included in the hospital formulary, what drugs should not be included in the hospital formulary. This drug selection is solely based on hospital pharmacist recommendations. Promoting formulary adherence. So the hospital pharmacist should promote the formulary adherence. They should guide and advise all the physicians, nursing staff to adhere to the hospital formulary while prescribing, while administering, and while dispensing to the pharmacists available in the hospital pharmacy. Then review and take action on all non-formulary drug use in the hospital. So hospital pharmacist has to review, is the drugs that are the drugs which are included in the hospital formulary being prescribed and dispensed and administered by the hospital staff or no. This should be reviewed, and if at all they find that they are using any non-formulary drug, any drug which is not mentioned in the formulary, if they are using that kind of drugs, they have to take action. Provide a copy of the hospital formulary to all the doctors in the hospital as well as the nursing staff. Involve the medical staff in various formulary implementing programs. Give much advertisement and publicity regarding formulary. So all the hospital staff should be made aware about the hospital formulary and the drugs that are included in the hospital formulary, so that they can stick to the hospital formulary. Then revision of formulary. So they have to continuously revise the hospital formulary to make any kind of additions or deletions from the hospital formulary. So what is a formulary and what is a drug list? Formulary versus drug list. So formulary, listing of drugs by their generic names followed by information on strength, form, posology, that is dose, toxicology, use and recommended quantity to be dispensed. So the formulary contains this list. Then what about drug list? Drug list is INF, Indian National Formulary. So in this, generic names followed by data on strength and form. So this much information is only available in the drug list. Example of drug list is Indian National Formulary. So every country contains a formulary. So here formulary, if you see, it is restricted to a hospital. Every hospital has a separate formulary. So in formulary, the drugs that should be prescribed, dispensed, administered, purchased or procured are restricted. So there is a restricted list of drugs, but in drug list there is no such restrictions. They will provide a list of drugs. We can either adhere to it or not adhere to it. So formulary is prepared locally by its own clinical staff who are present in the hospital. Information provided is subject to local needs and desires. So based on the local needs, that is the type of patients that are coming to the hospital, type of diseases that are cured by the hospital. So based on that kind of needs, the information in the hospital formulary is framed. But a drug list is prepared by country's outstanding clinicians, pharmacologists and pharmacists. So it is like a reference book. According to their pharmacological properties, they will be taking the drugs into the drug list. So National Formulary of India, NFI or INF, both are same, which is the drug list of India. NFI is not a regulatory document. So it is not a regulatory document. You can either stick to it or adhere to it, or you may not adhere to it or stick to it. So it is not a regulatory document. NFI would serve a guidance document to medical practitioners, pharmacists, nurses, medical and pharmacy students, and other healthcare professionals and stakeholders in healthcare system. So it is just providing a guidance or a reference. So it is not a regulatory document. There is no restriction that you have to follow the drugs which are there in National Formulary of India. The criteria for inclusion of drugs in NFI. So what are the drugs that are included in National Formulary of India? Drugs in National List of Essential Medicines 2011 India. Drugs used in national health programs like prevention of AIDS control programs, TB control programs, whatever national health programs they are using certain drugs, right? So those drugs will be included in the National Formulary of India. Drugs listed in Indian Pharmacopoeia. Then drugs not covered but recommended by panel of experts. So they have a panel of experts. They will be recommending certain drugs which are to be included in the National Formulary of India. Any drugs considered appropriate by the IPC, Indian Pharmacopoeia Commission. Then formulary editions. So they will be continuously revising and either adding drugs to the formulary or deleting drugs to the formulary. So coming to formulary editions, the assessment of new medicines is critical to managing a formulary list. So we can't keep the formulary list same for a long period of time. We have to keep assessing the formulary medicines, and we have to keep adding new medicines to it, which involves adding new medicines and deleting the old ones. Drugs should be evaluated and compared on the basis of efficacy, comparative efficacy, effectiveness, comparative effectiveness, safety, comparative safety, cost of use, quality, etc. So we have to evaluate the drugs and compare the drugs based on their efficacy, safety, cost, quality. So based on everything, we have to keep reviewing the drugs, and we have to keep adding new drugs and deleting the old ones. So efficacy, effectiveness and safety can be evaluated from a critical assessment of the literature. So literature helps in evaluating the efficacy, effectiveness, safety of the drugs. So literature is nothing but the studies that have taken place recently and also in olden times. So all the research articles, research studies will be taken into consideration. A request for inclusion of a drug in the hospital formulary shall be made by submitting a formulary edition request along with supporting literature. So if a physician or a hospital pharmacist or nursing staff, anyone wants to add a new drug to the hospital formulary, they can submit a formulary edition request along with supporting literature, along with the studies, medical studies that are published in the journals, articles, etc. So along with the supporting literature, if they are submitting a formulary edition request, and they have to also give a signed disclosure of dual interest to the PTC, Pharmacy and Therapeutic Committee. The committee will make one of the following decisions regarding the request. Either they will give approval with or without restriction. So with restriction means they will be restricting the use of the drug in certain population like pregnancy, children, elderly, renal failure, liver failure, etc. Or without restriction, that is use of the drug in all the populations. So either they will approve the drug with or without restriction. Then denial. Denial is complete rejection of the drug. So they won't be allowing to add the drug in the formulary. Then deferment. Deferment is holding the drug. Holding the drug until pertinent information becomes available. So you have submitted the studies which have taken place till the latest date. But the Pharmacy and Therapeutic Committee thinks that more additional information is necessary regarding the safety and efficacy or cost effectiveness or quality of the drug. So they will be putting the drug in hold so that more information comes into existence in the future. So there will be continuous studies taking place. So based on the future studies, they will be putting it in hold, and based on the future studies, if literature available is supportive literature available is enough for them, and they are satisfied with the literature, then they will be either approving it or denying it. Then deletion of a drug. Suggestions for deletion of drugs from the formulary may be submitted to the PT&C by any member of the medical, pharmacy or nursing staff. So similarly, while adding your giving a request, while deleting also, you can suggest for the deletion of drugs from the formulary. So any member of the medical, pharmacy or nursing staff, they can submit suggestions for deleting the drugs from the formulary to the pharmacy and therapeutic committee. In order to control growth of the hospital formulary, some additions will be balanced by deletions of another drug. So if you keep adding the drugs to the hospital formulary, the list gets increased. So in order to balance the additions, some of the drugs that are less safe, comparatively, they will be checking, and they will be seeing if the drug is less safe, less effective, less cost effective, has less quality, not get if the patients are not willing to take the drug, so those drugs will be deleted by the PT&C. So PT&C committee, this committee shall periodically review its stocks and various therapeutic classes on an ongoing basis to effect deletion of duplicate drugs whose usage is low, or those which can readily be replaced by less costly but equally. So some of the drugs, there will be duplicate drugs. So they have the same efficacy, same cost, same safety profile. So those are duplicate drugs. So they belong to the same class. They have the same safety profile, same cost effectiveness, same kind of quality, same effectiveness. Everything is same. So those are duplicate drugs. We need not have two drugs which are having the same profile, right? So they will be deleting the duplicate drugs. And also they will be deleting drugs whose usage is low. Some of the drugs won't be preferred by the population. They won't be taken by the patients. Patients won't be adhering to certain kinds of drugs. So whatever drug usage is low, those kind of drugs will be deleted, or those which can readily be replaced by less costly but equally effective drugs. So there will be new drugs which are available in the market which are less costly. So whatever drug is more costly and it has same therapeutic effect and same safety profile, that drug will be replaced by the less costly drug which is having same therapeutic efficacy or safety profile. Thank you for listening. Please like, share, comment and subscribe to my channel. Press the bell icon for more notifications.